Hi, I'm Dr. Dave Marquis, and I wanted to go over a couple more exercises that I see that if people keep these muscles happy, they're going to not have to be in my office or other offices very often because they're not going to be hurting. And the first one that I showed had to do with some of the muscles on the outside of the body. That was the gluteals. This next one that I'm going to show is a muscle group that's on the inside of the body. It's called the iliopsoas muscle. And the iliopsoas muscle is, Hippocrates actually called it the great masquerader. And he wrote a whole treatise on this because it can mimic a variety of pains. The iliopsoas can mimic uterine pain, bladder pain, low back pain, hip pain, thigh pain. It can cause deep aches in the low back. It can cause people to have a hard time standing up straight. So if you find that when you get out of a chair, you just can't quite get up, it's usually those hip flexors, that iliopsoas. So finding ways to effectively stretch that, there's a huge payout. So a principle that I want to share with you before I go into the stretch is that all muscles have what are called agonists and antagonists. So think of that as one group that's moving and another group that is either stabilizing or opposing that movement. The iliopsoas muscle starts on all 5 lumbar vertebrae and the disc. So it's an intimal player with our low back, but you access it through the front because it attaches to the front of those bones and discs. And then it joins in here at our hip on the inside at this iliacus muscle, and they become one. And then they conjoin and they have a common tendon that inserts right around here on your femur, and it's what allows me to lift my leg up. So every step you take, that iliopsoas is engaging. Every time you sit down, it's now kind of getting out of the way, so it shortens. Now here's the principle. Anytime a muscle contracts or shortens, the other opposing muscle group is going to be inhibited. So if I bring my bicep up and that arm contracts, my tricep still stays flaccid. Well, think about that down here. This really goes into play when people say, man, I just got to exercise my butt. I got a lazy butt. And we typically do because most of us sit so much. Because when we sit down and that psoas shortens, the glute max just goes on vacation. And then as soon as you try and stand up, it's not there to help engage the spine. And so you end up in that slightly bent position. So there's several different versions of this stretch. The first one that I'm going to show you is I just use a pillow so that I can buffer my knee on the floor. When you get to your mid-50s, you kind of feel your knees a little bit more sometimes. So what I'm going to do is drop down on my right knee because I'm going to stretch my right hip flexor, and I'm going to put my left foot out in front of me a fair distance because I want to have a decent range that I can stretch this muscle. Because now what I'm going to do is I'm going to arch back and I'm going to shift my weight forward, but my back is still staying upright, and I'm putting my hands on the outside of my thigh and rotating. So now I'm getting a good stretch through that iliopsoas, and it's also an internal rotator, so I'm externally rotating. I'm rotating away from that to allow for that flexor and rotator muscle to come to its maximal stretch. Now if you feel unstable, use a wall. Grab something that is stable out there so that you don't, fall over to the side. You can also do this stretch standing, where you do a modified lunge. Drop down, leave that leg behind you, and again rotate. And if you have a wall right here, a pole, you can hold on to that so that you have extra stability. There's another way that I've really come to enjoy stretching this, and it's using a device on the floor, but I'm going to show you how to do it with 2 bottles. Basically, all you need to do is have something that's not going to be too uncomfortable, and you place it about the width of your pelvis so that when you lay down on top of it, it's going to put a little bit of pressure into that muscle group. So I'll put the pillow out in front of me. I'm going to pull these guys back a little bit, and I'm just going to drop my abdomen down right over those 2 bottles. Right now my body weight is allowing for those 2 bottles to press right into that region where the psoas is, and I'm just working to relax my tummy And as I drop down into that a little bit more, now I've got a really good, almost kneading type action on that muscle. And you may not be able to see it, maybe you can. I'm rotating my leg in and out so that I can get a little bit of motion and have that muscle kind of roll over that bottle. And you could stay here, you could read for 3 to 5 minutes and allow that thing to stretch out. Now I'm just going to rise back up. I've just stretched my psoas 3 different ways. If you do that one daily, combined with the prior stretch that I was just showing you for the gluteals, you will have done a great service to your own low back, alleviating a great deal of low back pain, and you'll find almost immediately that you're able to stand up straighter, which is a huge blessing in itself. Nobody wants to drag their knuckles.